I'm Dr. Leonard Rose. I'm the Director of the Melbourne Pain Management Clinic and the Melbourne Migraine and Headache Clinic. I think that the technology is well and truly world recognised as a treatment for pain, one of the important treatments for pain in my view, and one which I've been recommending for many decades. Cefaly embodies the most recent advances in that technology in terms of micro-stimulation, microelectronics. We've had some experience with it since we were first introduced to it late last year. So far the results have been very promising. I can talk about one particular case. There's a lady who is currently in her 50s. She's suffered from severe headaches in association with some other pain-related problems for probably 30 years or more, and was having chronic daily headache, which was also associated with migraine. So she was having these episodes of pure migraine, what we'd call migraine with aura, and then she would also have the daily headaches relating to the fact that she was taking a lot of pain medicines. Since she's been using Cefaly, which is now about 3 months, her headache frequency has decreased dramatically, and her severity of those headaches has decreased markedly to the point where she's probably taking a quarter of the analgesic medication she was taking previously. So she's done extremely well. We've had 1 or 2 patients who found that the Cefaly helped them to sleep better, made some difference in their headaches. We've had nobody so far who's found that the treatment was caused some adverse effect, whether it be electrode sensitivity or whether it be a reduced sensitivity to the stimulation patterns. There's no doubt that the headaches, because migraines traditionally have been recognised as being most commonly seen in women, and certainly women in the epoch of their lives where they're more likely to be childbearing, to be working, etc. Having a migraine once a month or once a week is still a very debilitating thing. When you're having 2 or 3 migraines a month, losing days off work or losing days where you're unable to look after your children. In addition to that, they may have nausea, severe nausea, vomiting, visual defects. All of those things impact on their quality of life. And I think over the years it's been recognised that migraine is a disease which has more impact on quality of life than many other conditions, including some of the cardiovascular conditions and asthma, for instance. Cefaly appears to be a fairly significant step forward, and a step forward into the 21st century as an alternative to medication. The problem with medication is that most medication has side effects in some people, and therefore if you can find a treatment that works without patients having to take medication, it will reduce the frequency of the headaches, it will reduce the severity of the headaches, and if it's used on an ongoing basis, it may in fact reduce the frequency to a point where patients either have no migraine at all or experience a very, very occasional migraine. Those people who are able to reduce the medication usage, to improve their ability to stay at work or to get back to work quickly or to look after their child quickly, it's going to be a valuable asset.
A product by Oz Health Pharma.